Safety Lesson 3 covers ALARA and personnel radiation protection. ALARA stands for as low as reasonably achievable. It is both a legal requirement and a professional obligation. This lesson covers the three cardinal principles of radiation protection: dose limits, dosimetry, shielding specifications, and pregnancy in radiology. 10 minutes of content that governs how you practice every single day. ALARA is built on the assumption that there is no safe threshold for radiation, the LNT model. Because any dose carries some risk, every exposure must be justified, every technique must be optimized, and every dose must be kept as low as reasonably achievable without sacrificing diagnostic quality. 5. ALARA obligations. Every exposure must carry clinical benefit that outweighs the radiation risk. Radiographers are legally and ethically obligated to minimize dose to patients and themselves. ALARA applies even when dose is well below regulatory limits. Justify every exposure, optimize every technique, and use the lowest technique that produces a diagnostic image. 3 principles. Memorize them as a unit. They work together, and they are tested individually. Time. Radiation dose is directly proportional to time. Double the time near a radiation source, double the dose. In fluoroscopy, this means using last image hold aggressively and activating the beam only when actively imaging. The dose formula: dose equals dose rate times time. Distance. The most effective and immediately available protection. By the inverse square law, doubling the distance from a radiation source reduces the dose to 1/4. Stand at the full extension of the portable exposure cord. Every foot matters. Shielding. Interpose absorbing material between the source and personnel. Lead aprons attenuate scatter by 90 to 95%. Walls, leaded glass, mobile barriers. Use all three, together, on every case. The NCRP, National Council on Radiation Protection and Measurements, establishes the dose limits that govern occupational radiation exposure through NCRP Report 116. Occupational whole body, 50 millisieverts, MSV, or 5 rem per year. Cumulative lifetime guideline, 10 millisieverts times the worker's age in years. Lens of the eye, 150 millisieverts per year, though the ICRP has now recommended 20 millisieverts per year, and this stricter limit is increasingly adopted. Skin and extremities, 500 millisieverts per year. Declared pregnant worker, fetal dose limit, 5 millisieverts for the entire gestation. Monthly maximum, 0.5 millisieverts. General public and unrestricted areas, 1 millisievert per year. Students under 18, 1 millisievert per year. Same as public. These are ceilings, not targets. ALARA requires staying well below them. 4 dosimeter types. Know their differences. Film badge. Uses photographic film sensitive to radiation exposure. Filters distinguish radiation type. Monthly lab readout required. Sensitive to heat and humidity. Now largely obsolete. Replaced by more accurate technologies. TLD. Thermoluminescent dosimeter. Lithium fluoride crystals store radiation energy in electron traps. Heated in the lab. Crystals release stored energy as light, proportional to dose. Accurate, reusable, environmentally stable. OSL. Optically stimulated luminescence dosimeter. Aluminum oxide crystals stimulated by laser light. Most sensitive of the passive dosimeters. Can be reread multiple times for verification. Current standard in most U.S. departments. And the EPD, electronic pocket dosimeter, real-time digital display, audible alarm at a user-set threshold. Used in addition to, never instead of, a primary badge. Lead apron, 0.5 millimeters. Lid equivalent, the clinical standard. Reduces scatter by approximately 90 to 95%. Required for all fluoroscopy, portable radiography, and C-arm work. Never fold a lead apron. Folding cracks the lead lining and eliminates protection in that area. Hang upright on a dedicated rack. Inspect annually by fluoroscopic or radiographic imaging. Thyroid collar. 0.5 millimeters lead equivalent. Required during all fluoroscopy work. Reduces thyroid dose by over 90%. Lead glasses. 0.35 to 0.75 millimeters. Lead equivalent. The NCRP lowered the lens threshold from 2 gray to 0.5 gray. Strongly recommended for all fluoroscopy workers. Protective gloves. 0.25 millimeters. Appropriate for holding patients or cassettes in scatter fields. Never place in the primary beam. Gonadal shielding. When gonads are within 5 centimeters of the primary beam edge, and shielding won't obscure the anatomy of interest. Structural shielding in X-ray rooms is categorized into primary and secondary barriers. Primary barriers stop the useful X-ray beam directly. Required wherever the primary beam can be directed, the floor, walls, any surface in the path of the beam. Minimum specification, 1 to 16 inch, approximately 1.6 millimeters of lead or equivalent concrete. Secondary barriers stop scatter and leakage. Scatter is approximately 1/1000th the intensity of the primary beam at 90 degrees. Leakage from the tube housing is limited by regulation to a maximum of 100 millirem per hour at 1 meter. Secondary barriers require less shielding than primary. The control booth wall is always a secondary barrier. The leaded glass window is typically 1.5 to 2.0 millimeters lead equivalent. Shielding design is performed by a qualified medical physicist based on workload, use factor, and occupancy factor. Fluoroscopy delivers approximately 100 times more dose per minute than a standard radiograph. Workers in fluoroscopy environments accumulate the highest occupational doses in diagnostic imaging. Minimize time. Use last image hold for all review. Activate the beam only when actively observing anatomy. Pulsed fluoroscopy at 7.5 pulses per second can reduce dose by up to 75% compared to continuous fluoroscopy. Maximize distance. Stand as far from the patient as the procedure allows. Use all available shielding, lead apron, thyroid collar, lead glasses, under-table lead drapes, ceiling suspended leaded acrylic panels. Use a 2-badge monitoring system. Collar badge outside the apron at collar level, representing unshielded dose. Waist badge under the apron at waist level, representing shielded dose. 2 contexts for pregnancy and radiation: the pregnant patient and the pregnant radiographer. For the pregnant patient, never withhold medically necessary imaging solely because of pregnancy. The maternal benefit from timely diagnosis outweighs the radiation risk from diagnostic imaging in almost every clinical scenario. Use low-dose protocols, collimate tightly, and shield the uterus when it isn't in the field of interest. For the pregnant radiographer, declaration of pregnancy is always voluntary and must be in writing to activate regulatory protections. Verbal declaration does not count. The fetal dose limit is 5 millisieverts for the entire gestation, monthly maximum 0.5 millisieverts. A fetal badge is worn at waist level under the lead apron. The employer cannot reassign punitively or reduce pay for a declared pregnancy. 3 ALARA and protection questions. The answer is B, 1/9 of the original intensity. By the inverse square law, I1 over I2 equals D2 squared over D1 squared. Moving from 3 feet to 9 feet triples the distance. 3 squared equals 9. Intensity at the new position is 1 over 9, 1/9 of the original. Distance is the most practical and effective radiation protection tool available to the radiographer. The answer is C, 5 millisieverts, 0.5 rem, for the entire gestation. This is the NCRP fetal dose limit established in NCRP Report 116. There is an additional monthly limit of 0.5 millisieverts to prevent concentrated exposure in a single month. Declaration must be in writing. A fetal badge is worn under the apron at waist level. The answer is D. Electronic pocket dosimeter. The EPD provides real-time dose rate display and an audible alarm at a user-set threshold. This makes it the most useful device for workers in interventional fluoroscopy environments, where real-time feedback allows immediate behavioral adjustment. It is used in addition to a primary OSL badge, never as a replacement. You covered ALARA, the three cardinal principles, NCRP dose limits, dosimetry devices, shielding types and specifications, fluoroscopy protection strategies, and pregnancy guidelines. These principles govern every exposure you make.